Are you suffering from tightness and weakness on the posterior chain of your pelvic floor muscles? Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. In this video, we'll be discussing about posterior pelvic floor pain, weakness, and tightness. So if you're suffering from this, I have patients with constipation, pain during intimacy at the backside of your pelvic floor, and bladder incontinence. When they laugh, sneeze, and cough, they have a leak. And today, we're going to use a soft foam roller. If you're absolute beginners, join me and my friends, Vidi, who has a lovely Instagram page that you can follow with her Facebook and YouTube, talking about menopause wellness, integrative yoga, on how to focus on your overall health. If you're perimenopausal, menopausal women, check out the link in the description below. Join her lovely page to learn more on how to cope with menopause and perimenopause. And I have my friend Sandy, who's been coming with me in my weekly videos. And they have the 3 inches foam roller. If you need a soft, comfortable foam roller, check out in the description below. Click the link or comment foam right now and I'll send you the direct link to your direct message and learn more about this soft, comfortable foam roller so you can be consistent with your daily workout. So in this video, I'll be using the 6 inches foam roller. So it's a little bit more elevated and there's also 6 inches in my website. And this is good for a little bit more progression, which means there's going to be more instability on your posterior chain of your pelvic floor if you find the 3 inches too easy. But if you don't have a foam roller, you can use a roll towel for gravity assisted for your pelvic floor. So let's begin the program right now. So you're going to place the foam roller underneath your pelvis as you lie down in a horizontal position like this. Not on your lumbar, not on your hamstring. And breath work is important, so you engage your pelvic floor. So breathing is so important. So as you inhale, your diaphragm goes down and you don't want to lift through your chest. And I've seen that a lot in my patients. That's why there's bearing down to the pelvic floor. You want that piston canister motion. So as you inhale, so you can see my abdominal muscles rising because that gives space to the diaphragm to go down and it pushes the pelvic floor a little bit gentle stretch to be functional. And as you exhale, pretend you have a tight jean and you want the zipper to go up but without touching your skin. As you breathe out slowly through your mouth, slowly releasing the air, because if you exhale fast, you're releasing the pressure out. You want to make sure you inhale, expand your abdominal muscles, exhale, zip it up. So I'm making a sound so you can hear the gentle release of air, and I'm tightening my lower abs through my navel. I want going up, not going down. And imagining if there's a blueberry from your vagina going to your kidneys, or imagine not to pee, you want to close it in. You can place your hand on the ASIS here in your pelvic area and your lower abs, and you're going to feel that expansion and contraction. Again, breathe in. Let's warm up our engine, the powerhouse of our body, the core. Exhale, zip it up and lift. So the gravity assisted helps the pelvic floor, especially if your posterior pelvic chain, the backside of your pelvic floor is tight, weak, and if you're having constipation, that's gonna be really good for you to have a normal bowel movement, especially in the morning. If you're not having bowel movement in the morning, there's gonna be more pressure throughout the day, and that's gonna cause pressure on your bladder. It makes sense, right? You give space on your pelvic floor area. Again, inhale. So if you do this in the morning, this will help your bowel movement, so you have more space throughout the day. So you're not gonna have that leak when you laugh, sneeze, and cough. Now hold on to the foam roller for absolute beginners. As you breathe in, exhale, zip it up and lift one leg up to tabletop. So if you place a cup of coffee on top of your leg, you don't want that to drip and fall towards your face. If it's too high, you're dripping the coffee towards you. If it's too bent, you're gonna drip it out of your body. So tabletop looks like a table. This is the top of the table. This is the leg. As you breathe out, exert your leg up. Exertion means you put an effort, and that's when you breathe out. And then as you slowly lower your foot down, that's when you inhale. See, I'm expanding my abdominal muscles again. And then before I lift my opposite leg, I'm zipping up and exhale to tabletop. And you're going to tighten everything tight together. But because it's gravity assisted, guess what? There's no downward pressure. Again, inhale. Exhale, zip it up. So you can hold on to the foam roller because it might roll off for absolute beginners. And then inhale down. Exhale, switch. This is a beginner program. And we'll do this 3 more repetitions in each leg. Breathe out. And you're gonna feel some tightness on your hip flexors. The hip flexors are very important for our pelvic floor health to strengthen. So when you propel and walk, you're not dragging your hips. You're using your hip flexors as a mechanism to propel forward. Not just your glutes, but the hip flexors as well. Last set. Breathe in and breathe out. Zip it up and lift. Tabletop. Inhale and exhale to the right. Well done. Now we are progressing with a little bit lengthening of our hamstrings. So go back to tabletop again as you exert. Exhale. All the way to extension of your leg. You're going to feel beautiful stretch on your hamstring. Toes pointing to the heavens. And then inhale back to bending. Slow and steady all the way down. No plopping your foot down to the floor. Breathe in and breathe out. Extend. Lock your knee. Feel that beautiful stretch. Breathe in. Breathe out. Squeeze your core in as you breathe out. Inhale. Exhale. Switch. Feels so good. You feel the stretch, guys? Isn't that beautiful? Yes. It looks so simple. This is a great way to end any workout. If you've been running, walking, jumping, lifting heavy weights, cooling down is so crucial to improve the pelvic floor health, especially at the end of the day, right, guys? Yes. Good job. Last set, my friends, on the right side. Breathe in. See, you can see the expansion and zipping it up. Slow and steady. We're not doing it too fast. It's about control. Well done. Now we're going to lift one leg up, toes pointing to the heavens. And then we'll do a beautiful circle like a size of a small dish without rocking your hips. Slow control as you breathe in, breathe out. Feel that beautiful lengthening, keeping your toes pointing to the heavens. No movement on your ankles. Keep it straight. It's all on the hip. And then we'll do reverse circles. Lock your knees if you can. Inhale. Exhale. Squeeze your core in. Well done. Now from this position, hold on to the foam roller. We're going to lower to the side to open your hip adductors. This is the mirror of your pelvic floor. And if you're tight there, it's tight inside. You want to make sure you breathe in and breathe out to the side as much as you can. Don't force yourself. Keep your pelvis aligned against the foam roller. Beautiful. Breathe in, breathe out. Slow and steady opening. Feel the gentle release of your hip groin muscles. Can you feel it, guys? Beautiful. Last set. We're just doing 5 reps. This is a beginner program, so you're not overexerting your pelvic floor. Because pelvic floor, you have to be gentle. They're very tiny muscles, like a basin, and you don't want to overstretch it. We have slow and steady. Breathe out as you open. Inhale as you go into the center. Exhale as you slowly lengthen and breathe out. Zip it up. Don't forget that blueberry going up when we warm up our engine. Inhale. Exhale, open. Feel that beautiful stretch. Inhale, keeping your pelvic aligned. So you can hear my breathing, so you can remind yourself to not to forget to breathe. Last set. Inhale, exhale. Well done. Now lift both legs up to the heavens. We're going to do double leg circle. So I'm pointing my legs, hold onto the foam roller so it's not going to fall off your hips. Underneath your pelvis, slow and steady, engage your core. Breathe in, breathe out. Tightening as you exhale. We'll do it 10 repetition circles. And then we'll do reverse. Now reverse the circles. 10 repetitions as well. Inhale. Exhale. Squeeze your core in. Let's lengthen our hips, especially the posterior chain of your muscles that we talked about earlier. So you have better bladder control and prevent the constipation. Now, from this position with your toes pointing to the heavens, take a deep breath. As you exhale to a V stretch. V stretch is a great way for your hip adductors to lengthen and open. If you need to adjust, that's great. If the foam roller is rolling off, so hold on tight. And if you're absolute beginners, you don't have to do dorsiflex your ankles towards you and then back to the center. And once you're back to the center, you inhale, tip your toes again to the heavens. Inhale, exhale, open. Lengthen. And once you reach that V stretch, you dorsiflex again to lengthen. Inhale, exhale. Squeeze your core in as you open. Dorsiflex as you go back center. Inhale. 2 more. Don't forget your breath. Last set. Open. Well done. Now we're going to do figure 4. This is going to target the posterior chain. The piriformis muscles is one of the pelvic floor muscles. That's you're gonna feel when you palpate inside of yourself if you do self-assessment. Bending your knee to your chest if you can. If this is too advanced, you can just keep it straight. And then we're gonna slowly bend and straight. We're cooling down now. You're gonna feel that lengthening of your hamstrings and your piriformis muscles using the foam roller. Breathe in, breathe out. Now hold that bent position and I'm gonna rock side to side for a deep stretch on the side of your piriformis muscles. Left and right, hold on to the foam roller. Beautiful stretch. We'll just do 2 repetitions. We're almost done. And then switch to the other side. You can do this every single morning before you start your day or at the end of the day, especially if you've been standing all day. So let's switch to the other side. So first you can bend and extend to warm up before rocking side to side. Inhale and exhale. And that's it. I'm hoping you enjoyed this simple posterior chain pelvic floor targeting those deep muscles that is hard to stretch because of its pelvic floor. It's very deep, it's hard to target. And if you need my help and guidance, check out the link on the description below. You can join my Revive Pelvic Floor Health Core Rehab free 7-part video series. 7 videos you can learn right now to target your pelvic floor for free. Click the link on the description below. Thank you so much, Vidi, my friend, and Sandy for joining me today. If you have more time today, check out my Core Back Immersion Therapy video 1 on how to learn more about Core Back Immersion Therapy, and video 2 on how to learn proper breath work. I know it's very difficult to proper breathe right now, but it will get better, I promise you. Until my next video training, always remember, be safe, be well, and healthy you. Bye!